Hey everybody, it's time for Avian First Aid, episode 15. This episode is all about trauma.
Trauma, and trauma is pretty broad, but what I mean is kind of body trauma, so concussion. And the common thing with that is the bird that hit the window or flew into the wall. And it can be not very serious at all. They land and they're wobbly for 2 minutes and then they fly away again. Or it can be so bad that they can't stand up and they have bleeding on the brain. So if you see it happen, which a lot of times you will, you probably can pick that bird up immediately and support him. Be really careful not to restrict the chest, because in addition to the head trauma that might occur, they often have the wind knocked out of them and they're having trouble even breathing. So just let them sit calmly for a minute. If it is going to be a minor one, usually within a minute or two, they're looking pretty good and they're right back to normal. What you would assess is symmetry of stance. Like, you want a bird that stands straight. If they're standing with the head tilted one way or another, or circling to one side, or drooping on one side, that would be a sign that you had additional damage, more than just the wind knocked out of them. If you look at the eyes on each side and the pupil is big on one side and little on the other side and stays that way, that's an indication that you have changes internally. So those are the things you would assess. If you get them early, you can use anti-inflammatories to take down swelling in the brain. You probably need to see them within 4 hours to do that. Most of the birds that hit the wall don't have serious head trauma, but if you see bleeding like from the ears and from the nostrils, then that's a serious one, and you probably want to have that looked at right away. If it's not, then what you want to do is use your hospital cage, do supplemental heat, do minimal stress. That's not the day to have the kid's birthday party, like around their cage and stuff. They should be quiet. It should be dark, because light will make it worse for them, and then check on them every hour. And if they look like they're deteriorating, like if they look quite good at first and then all of a sudden they can't stand up or they're going circling, then get them somewhere where they can be treated. When you're doing a hospital cage for a head trauma bird, you want a flat bottom. You don't want anything they can climb or perch on, because they're unsteady anyway, so a flat bottom is the best. Trauma to the body, usually that is crunched by a pet, or I was coming down the stairs and my budgie was on the stairs and accidentally stepped on them. And the trauma there is usually chest trauma or abdominal trauma. If it's mild, just bruising, then they will look quite good initially, and the next day they will look quite bad, because the maximum bruising happens 24 to 48 hours afterwards. So initially what you want to do is assess if you think there's internal bleeding, which you would assess by getting shocky, meaning being unable to stand, bending over and eyes closing too much. And the difference between that would happen progressively, because they're not going to have blood loss the second that you step on them or your dog grabs them. Initially what will happen is they'll have the air knocked out of them, and within 2 to 5 minutes they should be up and back to normal. If they are up and back to normal and you think, hey, everything's good, keep watching them every hour, because if there's internal bleeding, then they're going to start decompensating later. And if you start seeing that, then that's a sign that you probably need to give them some fluids, warm them up, and get them somewhere. The prevention for that, obviously, don't have them out with other pets. Even though your dog might be a wonderful dog most of the time, if something triggers him, they're normally animals that would hunt birds. Same thing with cats. Just don't take a chance. Don't have them out unsupervised. Trauma to the eyes. Birds actually seem to have quite tough eyes. I don't see very much trauma to the eyes. I see more eyelids. So if they happen to get into trouble around the eyes, it seems to be the lids that are affected, which usually is not an emergency. You control the bleeding. I usually have eye wash in the kit to flush, because if a bird gets a chemical in an eye or something on an eyelid, it doesn't sting as much. It's buffered if you use either you can get eye wash from this pharmacy, or you can use saline from Contact Solutions. It's sterile, it's buffered, it rinses them off, and it's safe.